Good morning, everyone. Thank you for session 5 of the Light Wellness Experience Workshop. I'm Regina Lassell, the CEO of the Light Vitality Group, and I wanted to thank you all today for joining me on a special edition of the Experience Workshop tailored specifically for physical therapists and occupational therapists. As you know, I have been working with an occupational therapist, a licensed therapist for over 15 years, and she has provided valuable insight into the inner workings of different types of facilities. So, inpatient, outpatient facilities, skilled nursing facilities, assisted living facilities, home health, hospital settings, school settings, right? So, we've kind of broken down different nuances for each of these space types and come up with a list of recommendations and practices that could be applied inside these settings. So for all of you physical therapists and occupational therapists who are joining us today, keep your your eyes and ears peeled, right? So that you don't miss out on some of these wonderful recommendations to enhance the well-being of your patients. Now, Valerie, my advisor, right, is not able to join us today for personal reasons, but we have a couple of pre-recorded broadcasts that we've done together. If you go to Light Vitality Group's official YouTube channel, you can find a conversation with Valerie Fall, licensed occupational therapist. You can see kind of highlight reels from some of our conversations, and hopefully I'll be able to get her on here again at a later date. But if you are an occupational or physical therapist and feel you can contribute to the light and health conversation, I invite you to join me. I would love to meet you. I would love to talk to you personally, and perhaps sometime do a segment with you as well. So I hope everyone is paying attention, and that we can go ahead and get started. There are no workbook pages for today's discussion, but I will be posting additional resources on the Facebook page a little bit later today. As you know, the format for this event is really a one-to-one discussion with hopefully some two-way interaction. So if you are there, drop a comment. Let us know how you're doing. Let us know how your week has been going following Light Wellness guidelines. Have you noticed or observed any health transformations in any of the biofunctions that pertain to circadian health, whether that's primary, secondary, or tertiary, right? How are your sleep-wake cycles? Are they aligning? Are you waking up and falling asleep within 15 to 30 minutes of, the same time every single day? Or are you noticing that, over the course of 5 days, you've seen a, half an hour to an hour and a half shift in your sleep-wake times, right? From day 1 to day 5. I would love to hear from you. Are you noticing any kind of changes or transformations in your gut health? Or do you think you're digesting better, metabolizing a little quicker? Do you feel like you have more energy? Are you feeling a little bit more focused and alert, and your mood is elevated, right? How are your interpersonal interactions going, right? Are you having positive interactions with other people, or are you kind of struggling? I would love to hear these things if you are willing to share them. And remember, you can always reach out personally inside the direct messages as well. A lot of light wellness, as we've reiterated, is a personal and intimate caretaking journey. And so if you don't want to share publicly, that's more than all right. But I would love for you to take this opportunity while we wrap up the Light Wellness Experience workshop so you can get some free consultative time, because during the workshop, that's what this is here for. That's why I'm your concierge. If you have any questions pertaining to your health and your well-being, or light wellness solutions that you may or may not be implementing, what resources you may have available to you, right, or lack thereof, talk to me about it. This is your free time to be able to communicate all of these different nuances and efforts, and a kind of understanding of what we're discussing, right? After this, I will post what my typical rates are. You can also find them on the website at www.lightvitalitygroup.com/community. There is a link there that offers what those rates are after the workshop. So again, I reiterate, utilize this workshop as a time to get some free consultation. Drop me a direct message. Let me know how things are going. Ask me any questions. And yeah, so with that said, let's go ahead and get started. As you know, the first 4 days of this workshop has been all about educating on circadian health and the various biofunctions that are tied to circadian rhythms and dependent on that very specific biomarker of sleep-wake cycles, right? Melatonin and core body temperature. And we have so many other amazing body functions that are tied to supporting that. We have our heart health, we have our immune system responses, right? Inflammatory markers, white blood cell counts, cardiac rhythms, right? We have our gut health, digestive enzymes, hunger hormones, right? Human growth hormone, a part of our physical recovery, helping us to build muscle and repair skin lesions and allocate electrolytes and everything we ate throughout that day. So again, if you're noticing any of these changes, let me know. I would love to hear it, but understand that in order to kick off all of that, right, the other 3 days of this workshop, we talked about light and the very specific metrics of the light based on, our absolute values, that spectrum versus time of day or with time of day, and then the relative values that, have a relationship to absolute values, which are our intensity of light or the output of the light and the duration of time we need to receive that intensity based on spectrum and time of day, right? So we have all these wonderful, unique recipes that are very personalized and tailored to your lifestyle under light. And so let's talk a little bit about how that translates into physical therapy and occupational therapy. We have seen from a recovery standpoint that the repairs, the skin repairs, scarred tissue and whatnot, winds up accelerating its reparation process during the nighttime hours. So that doesn't necessarily mean that it's best to get injured at night, right? It just means that the most active repair cycles are happening at night, and those are those regenerative processes. And a lot of that has to do with the human growth hormone, but it has to do with a lot of other biofunctions that have those kind of night shift gene clocks that working inside our body, right? And there have been ample studies done on particularly clinical studies inside assisted living facilities, senior living facilities, or senior nursing facilities, particularly for Alzheimer's clinics and the effect of sundowning, right? Because they have such trouble and tormented sleep that this became a very wide area of study for that particular let's say demographic, right? So what are we seeing? We're seeing that light wellness solutions can be particularly supportive for pain management and fall prevention, right? We're seeing that light wellness solutions can be seen for behavioral management, right? We mentioned sundowning, and for cardiac rhythm alignment, right? Which can be a very, hot topic, if you will, for aging citizens and really across the age spectrum and age and ability spectrum. But we are seeing particularly in SNF and ALFs and home health patients that, there's a lot to be attributed to cardiac immune system responses, behavioral management, right, for that age demographic. So, where are some of the facilities that are going to be best supported for light wellness solutions in order to address pain, fall management, behavior management, cardiac rhythm alignment, right? And those ones that we've identified through my advisor are outpatient and inpatient clinics, right? Inpatient settings, home health, SNFs, right? Skilled nursing facilities, ALFs, assisted living facilities, right? Hospitals, of course, and we know that from, PT and OT practitioners work closely inside hospital settings as well in clinics. Um, and and yeah, and school settings, right? I know that when my son was in his physical and occupational therapy, his occupational therapist was in fact working two jobs, one for the early intervention program, and then also for school, right? And she started to apply these settings. And actually, you can watch her a testimonial from day 9 of April's Light Wellness Experience workshop. I believe that it was either the 19th or the 21st. So, with that said, what can we do, right? What can we do in order to address this? So I'm going to read from some notes. So I apologize if I'm not keeping, your attention with my eyes. So first and foremost, one of the things that is going to be so critical for implementing this inside your practice is to be able to provide patient education and guidelines, right? The bulleted benefits of why we're applying these guidelines, which LVG can provide for you. And then to provide caregiver education and guidelines as well. And for the most part, they tend to be the same, but the education for caregiving is a little bit more detailed than that for the patient, right? Because you're going to be helping support them in these efforts as well. In some cases, we might need to provide staff education and guidelines, right? And in other cases, we may have to provide a sleep-wake evaluation. And we have that evaluation. There are questions that are specifically asked from the National Sleep Foundation, right? They're not LVG's questions. They are the National Sleep Foundation's questions, and they are available on the NSF website. You have to dig a little for them, but we found them. We have formatted them into a questionnaire. We've applied some LVG quirkiness to it for a core scoring system. So if you're interested in implementing this inside your existing PT or OT practice, regardless of any of the facilities that we've mentioned thereof yet, those are kind of the first initial highlights. You're going to need to be able to provide patient education and guidelines with bulleted benefits. You're going to need to be able to provide caregiver education and guidelines. You're going to need to be able to potentially also provide staff education and guidelines, depending on what kind of facility you're in, and a quick sleep wake evaluation to assess and identify what kind of sleep hygiene you're working with your patients, because as we know, sleep is so critical to balance and coordination and maintaining focus and alertness, right? So let's talk a little bit about some of these applications that we can use. So proximity to windows during therapy and treatments. All right. If you look at the light wellness guidelines that we gave you in the beginning of this workshop on page 2 of your workbook, there is so much to do with daylighting. And as we've mentioned throughout this workshop, especially on day 3 in applications, that, not all electric lighting solutions are able to provide one and or the other of the light profiles, the circadian, stimulating light profiles we need, right? Whether that's a daytime wakeful or evening sedative. And so daylighting becomes such a critical tool in our wellness toolbox. And we've all read the articles. We know that daylighting is good for us, or go out and get 15 minutes, of morning daylight. We don't know why, right? But now you do. If you took this workshop, you know why. It's because of that very specific spectral content in the morning that's not as ever present in later afternoon daylight, right? Because of the rotation of the earth, right? Day 3, positioning matters, where you are matters. And so, yeah, we want you to really take stock in those wellness guidelines and understand there's a difference between the access to outdoor daylight levels and indoor daylight levels. Indoor daylight levels are always going to be significantly less than outdoor daylight levels, and it's because of shielding angles, because of the size and scale of windows, maybe because the orientation orientation of the windows may not be east or south in the, northern hemisphere, or well, let's say south, right? Because east and west are going to be the same regardless, right? Where you are matters. Um, and so, you want, if you're going to be doing sessions inside, right, you want access to windows. Now, these can be broken down into, as you remember, our nested models or our lifestyle models. And there are a number of applications for nested models, right? Because not all clinics are going to have an open workspace. You might have smaller rooms where you're doing exercises or separating from the rest of the patients inside a space, right? Or it might be your own private room where you're doing these exercises. In that case, we definitely want to try to have access to daylight regardless of where you're sitting, particularly in the morning and in the afternoon. Right. And if you can get treatments outside, do it when possible, right? If the weather's permitting and you don't have any particular issue with allergies, or, any kind of respiratory issues, then I will say, if you can get outside and do your therapies, more power to you, right? But remember, try to keep natural daylight a part of your therapeutic routine up until about 5 p.m. and particularly for our more kind of senior patients who might have earlier bedtimes. Remember, we want to remove that spectrum of light approximately 2 to 3 hours before they're going to bed. So if you have a patient who's coming later in the day, right, one of the questions you can ask them is what time they plan on going to bed that night or what time they go to bed regularly. And you can kind of tailor your schedule around there and what their treatment under light is going to be like, right? Because we want to remove that spectrum 2 to 3 hours before they go to sleep. Remember, windows, they can, depending on their size and their scale, they can be bright, they can be glary, they can be uncomfortable, or if they're really big, they could just seem so wonderful. And the contrast of, the darkness of maybe walls against the brightness coming from that window might not be so harsh, right? But if it is, have some sort of blinds or shading agent in place. And so that way, you want to be able to, if you want it to be nice and bright, keep the blinds open, keep the shades open. If you want to dim it down, draw the shades, draw the blinds. So let's talk a little bit more overhead, right? We want you to keep your lights on full output, right? During the day, right? We said upwards of 5 p.m. Keep those lights on at full output, even if you think that, you don't need that much brightness in order to see, right? As long as it's visually comfortable and maybe you be mindful. You don't want to create a ski slope effect where you have, really white floors or really light colored floors that were reflecting a lot of light back up at you. So it kind of becomes glary, right? Imagine walking on like a really crisp, bright sidewalk in the high noon, right? Sometimes it's like, oh God, I can't even look down because the sun is glaring in my eyes. You don't want to do that to your patients, right? But to that point, a lot of your patients may be laying on their back during exercises or be in some kind of supine or prone position, right? So you're going to want to be able to provide an ample downlight that while they're laying in that prone position is essentially kind of that vertical lighting, right? Remember that input comes, or the most effect we have from healthy lighting solutions is between 30 to 90 degrees. So if you don't remember that, check out the post from a couple of days ago with all the diagrams included in it so you can recall that at any point. Let's see, what else can we do? If there is track lighting, right, we don't necessarily want so much glare from a tiny little source, right? So during the day, you can aim your track lights up at the ceiling to create reflected light back down. You can aim the track lights onto, the walls and reflect light off of the walls. You can also aim them directly at the patient if they feel comfortable in that type of a setting. I think track lights are a wonderful application solution for these types of clinics and facilities, because it gives you a wider range of modularity, right? Of being able to kind of aim and direct light at patients, particularly in open space clinics, rather than in enclosed spaces inside clinics or in private patient rooms, right? So if you have an open space where you're gathering a number of patients and a number of therapists doing various activities, whether that's with equipment, whether that's floor work on mats, having some sort of track lighting solution could be a wonderful solution to distribute light specifically onto your patients while they're doing their exercises, so that they can stay awake and alert, and maintain that balance and coordination that they need, right? And while also supporting their circadian rhythm so that they can rest better, so that any wounds and issues that they're dealing with, muscle issues, bone issues that they're dealing with, right? Why they're actually in physical therapy, or potentially occupational therapy, right? That they're going to be able to heal better throughout the night, right? Or to recover, not heal, let's not say heal, to recover better throughout the night. And again, every human is different. Everybody's body is different. So I encourage you, if you're doing this yourself as a patient, or if you are a practitioner, to have so much patience with yourself, with your methods, with your body, with your patient's progress and your patient's body, because we're all different. And as you know, circadian health isn't just light intake, right? It's nutrition, it's exercise, it's the chemicals we breathe in and ingest, it's so many different things. It's mood, it's chronotypes and chronobiology. There are so many reasons why. So remember, light is the foundation, it is the starting point. And if you're not able to see transformations or accelerated progress while applying these types of lighting solutions, then I encourage you to speak to another specialist or another doctor and see if there might be some reason why your circadian health is being impeded. Maybe there's a genetic marker. Maybe it's a behavioral lifestyle choice, but at some point or another, if you don't see any kind of transformations in your circadian health and the, secondary and tertiary biofunctions, or even the primary biofunction that's tied to it, seek out a professional and see what else may be going on and why light isn't able to help support you in this way. There are going to be so many reasons. So again, I encourage you to be so patient with yourself and your process, and for today's session specifically, with your patient's processes, right? So what else? School settings, right? Same concept. You might be in a classroom, you might have access to being outdoors, you might have access to windows, having some sort of modular ability to address light, whether that's shading devices for natural daylight, or if that is track lighting to be able to aim and direct, or maybe you have, down lights that have both direct and indirect lighting applications on them. These can be wonderful ways to distribute light more evenly, so that you're not creating a glare effect and something that maybe distract or potentially, prohibit your patient from being able to do their exercises effectively, right? So nice diffused light when and where you can to make it comfortable for them. Let's see, we have, home health, right? That could be, outpatient. Well, we can do inpatients, we can do SNFs, right? It could be your own home. We can go around and we can educate on downlights, how to use them, which ones should have dimmers and which ones shouldn't. Potentially look at helping rearranging more modular light fixtures, whether that's table lamps. Again, if you have track lighting that either can be aimed or adjusted or relocated on the track, right? We can look at those things. You can go through your house, right, or through their home. If you're a physical therapist doing home health or an occupational therapist, you can go through the home and you can educate them on different environmental settings. And actually today, Nicole will be joining us again from our discussion yesterday, and she's going to be able to walk us through that a little bit more in depth. So I think stay tuned, because I think you're going to enjoy that. Maybe it's something as simple as looking at seating lighting arrangements, right? The proximity to windows, the proximity to other electric light sources for comfort elements. So things of that nature. Maybe it's breakfast, right? Breakfast by a big window. We talked about that in the light wellness guidelines in the beginning of the week. Again, sedative profiles. You want all blinds closed, up until below the eye level. So maybe you close your blinds, but you crack open the bottom of your windows to let natural daylight in to create some footpath lighting below the eye level. We're not saying get rid of all daylight. We're not saying that's always 100% necessary. We're just saying try to remove as much overhead light as possible from above the eye level or from that vertical orientation between, where you're going to get light access between that 30 to 90 degree angle as seen in the diagram, so that you can allow your body to release melatonin and fall back asleep more easily. And do that between 2 to 3 hours before you need to fall asleep, because remember, that's approximately how much time you need to be able to allow melatonin to refilter throughout your body. So again, be so patient, right? If you're someone who keeps your lights on overnight, or if your patients particularly, ask them, what's their nighttime routine like? Are they keeping their lights on up until the moment they go to bed? Are they overhead lights? And then ask them how long it takes for them to fall asleep. And I would love to ask Nicole this as well when she joins us, what's that typical response? Because I know a lot of individuals who I ask say, yeah, I keep my overhead lights on, up until I fall asleep, and then I can't fall asleep for another 2 hours. My mind is just racing, and it's much more physiological than psychological than we realize, right? Because we need that 2 to 3 hours to fall asleep. So it makes a lot of sense. If you've been suppressing your melatonin up until the point you turn those lights off, you need 2 to 3 hours in order to be able to fall asleep, right? So you're just laying in bed, tossing and turning. So try to do that before you lay in bed so you don't get super frustrated, right? Because then your anxiety is kicking in. You're wondering why you're not falling asleep. You think something is wrong with you, and there's nothing wrong with you. And there's nothing wrong with your patients, right? It's a perfectly natural function of circadian health. And when you know it, you know how to address it and you know how to get ahead of it. And that's what we're trying to impart inside this workshop, right? Particularly today. So let's see, what else can we do? For group settings, whether, especially in group settings when you may not have so much ability to kind of modulate your lighting and adjust it specifically, there are some ways that you can avoid glare from the sun, right? You have a deep space, you want to get a lot of light in there, and you might have a patient who is, 20 feet inside your facility, and then you have a patient who's right next to the window, right? That patient who's right next to the window, southern facing window at, between 10 and noon, it's going to be probably maybe a little hot, a little uncomfortable. And so a way that you can try to redistribute that natural light into your space, rather than it just kind of having a hot spot immediately in front of that window and having a little bit of ambient light deeper into the core of the space, right? If you want to spread that light from that peripheral area around where the windows are and get it to penetrate deeper into your space, there are some ways that you can do that. You can use, and I'll drop these in the post later, right? You can apply the white semi-translucent tracing paper, right, to an area of the window where the patient will be, maybe not the whole window, maybe just a portion of it, right? You can have number 2, right? And that's just one, right? I'm not saying tracing paper is the end all be all. You can have small to medium size modular translucent screens handy, right? You can have them handy to roll in and set in place during floor activities to diffuse light from direct glare, right? So if you're laying on the ground, or if your patient is laying on the ground in front of a window and it's kind of uncomfortable for them, maybe have one of those rolling screens available, right? So that you're able to diffuse that light. So you're making it more comfortable for them, but you're also scattering more light to go deeper penetration into the space. Very handy something to have. And I'll provide an example of that in the post later. Solution number 3, diffusing contact paper for windows, right? Instead of tracing paper, like tracing paper is that kind of bare minimum, just have it on hand. You can have contact paper and apply it, right? It can create privacy, it can create diffusion, it can create comfort from glare. Sometimes diffusing really bright lights on smaller windows and spaces can create more of a glare effect. So again, you want to think about the size and the scale of the windows that you're applying these applications to, and whether or not diffusing the light is going to create more of a glare issue versus solving a glare issue. And so typically kind of a good rule of thumb for that is you want your window, you're going to probably be creating more of a glare solution if you're looking at around, let's say 1/8 to 1/6 of the size of the wall. But if you have more like 1/3 to 1/2 of the wall that's windows or more, right, then you will have kind of a nice contrast agent to not have so much visual glare discomfort. And then I can provide more specific metrics and scaling dimensions for you in the post as well. But, just think, the bigger the window, the less glare it's going to seem to the contrasting agents around it. The smaller the window, the higher the contrast is going to be, thus the more glary it's going to seem. Think about, I think a good example for this is think about a headlight on a car, right? A headlight on a car could be giving out the exact same amount of light as a, 10 by 5 foot window on a wall, right? But the 10 by 5 foot window is going to seem less glary and less bright because the scale of it in contrast to the surrounding environment and how much that, access of a view that light is actually getting to you through, right? Versus the headlight on a car. It's much smaller. It's the same amount of light that's coming through that window, but it's a much smaller source and surrounded by a much larger high contrast area. It's going to seem much more glary. So just something to keep in mind when you're looking at that. Number 4, clear modular privacy screens with diffusing contact paper. So same concept. You can have a diffusing screen. You can have a clear one with contact paper provided. They can be small. They can be larger. Just something to keep in mind. For fall prevention specifically, before I bring Nicole back into the conversation from yesterday, falls have been studied very specifically inside senior living facilities and skilled nursing facilities, particularly for Alzheimer's and dementia patients. Some of the studies that I've seen coming out of the Lighting Research Center that we've dropped a couple posts about and we've mentioned a number of times, I've been able to identify that most of the time people think that in order to prevent falls, it's because of visual acuity and, our patients need more light in order to be able to see the surrounding environment. But what they've come to realize is that they don't need higher illuminance or higher light output levels in this space, but more focused light levels in this space and focused contrast values. So like what we were just discussing, right? The headlight versus the large ambient window. That if we can, so they created a novel lighting application and where they trimmed and outlined doorways with low ambient amber linear lighting solutions at night to create a kind of diffused glow around the door. They removed overhead lighting and lighting from above the eye level, and they kept the light levels underneath 15-foot candles. And what they saw was that, using 65-foot candles versus under 15-foot candles, 65-foot candles of diffused ambient glow versus 15-foot candles of very focused linear lighting, framing doorways and entry ports, right? And then they also used LED laser lights to create pathways of light, again, a high contrast area versus a low contrast area, so that that patients would have less weight distribution when they were standing and walking so that they could stay more stabilized and would thus have less potential to fall and to have a marker, right? A visual marker that they would have a goal to get to. So that was that framed doorway. What they saw by keeping the light levels low, they were able to maintain circadian entrainment. They were able to see that patients were now sleeping throughout the night. Upwards of, I believe it was over 70% of their patients or over 80% of their patients were sleeping through the night, and they reduced falls by up to 60% or just over 60%, which is huge from a health and well-being standpoint, from a financial health indicator. Remember yesterday we talked a little bit about the return on investment versus the value of investment, where return on investment are strictly financial indicators, right? I'm investing money in something and this is the financial value I'm going to get back from it, versus the value of investment, where we're talking about health risk indicators. We're talking about productivity indicators. We're talking about emotional well-being indicators, interpersonal relationship indicators, which thus eventually translate into financial indicators in the long run, right? And this is one of those where we see enhanced quality of life, a reduction in health-related and health risk kind of potential or problems or impacts that can result in lower financial cost from the patient to the clinic to insurance companies to hospital expenses, you name it. The financial footprint for falls and falls prevention is huge, right? So with that said, I hope that you gained a lot out of this, and I'm going to go ahead and introduce Nicole Sondermann again, registered and board certified sleep clinician, and let her share a little bit more about the types of practices that they use from an occupational therapy standpoint to support sleep health and overcoming certain sleeping disorders. So I'll let her introduce that a little bit better herself. With that said, hi, Nicole.
Hi, how are you?
I'm good. How are you doing?
I'm doing well, thank you.
Thank you so much for joining us again today. I know my OT wasn't able to make it, so you were like, "Hey, I'll step in. Do you need me tomorrow?" We actually have some OT things we do from a sleep clinician standpoint I'd love to talk about. So I appreciate you offering that and joining me again today.
Thanks. We do. We've been using occupational therapy for years, helping the families learn how to incorporate healthy sleep patterns and behaviors in their home. And we work with families, we work with the kids, we teach how to create a new pattern, a new behavior, and incorporate it by practicing it every single day. And I love what you said about the lighting, because ambient lighting is so important. Having the dim light before going to sleep. And we talked about that yesterday, and we use it all the time in sleep medicine.
Good. Good.
So what questions can I ask, and what questions can I answer for you?
So I believe, you talked about the creation and acclimation of a bedtime routine. What types of methods do you educate both patients and caregivers on creating a home environment and behavioral patterns to encourage sleep, right? And particularly from an occupational therapy standpoint.
So an occupational therapist, once a child needs to come into the sleep lab for a study, an occupational therapist will work with the family, teaching them about the bedtime routine. And the bedtime routine could include having a glass of water and taking a shower and then going to bed. And a lot of times they incorporate meditation and relaxation, and they incorporate the senses, especially with the sensory kids. What do the sheets feel like? What does the pillow feel like? When you lay your head down, it's familiar, it's soft. And if you need to adjust, they'll work with the kids and let them know that they can be comfortable getting comfortable in their bed. So it might mean flipping the pillow 3 or 4 times. Sometimes they incorporate music and lighting, like the little stuffed animals will play music. and the parent can have the lights on at one level, and then slowly, as they're reading the story, bring the lighting down softer and softer and softer. And that's what you were talking about earlier with adjusting lighting to increase the melatonin level and relax the patient. And they do a lot with breathing exercises too. So you breathe in something that happened during the day, maybe 2 breaths, and then breathe out. Exactly, like 4 breaths. And whatever was bothering you during the day, that's gone. You let it go. So you breathe in, maybe it's a color, and then breathe out, another color. And there's also a pattern, it's progressive relaxation. For people that do yoga, it's yoga nidra, it's the yoga of sleep. But you start with the toes and you inhale, think about something, tense your toes, and then let the air out and relax the toes. And you can do this when you're in line at Publix, and you can do it in bed. It's a behavior that works. It's a relaxation behavior. And occupational therapists will, along with sleep technologists, will work with the families, teaching the kids that. A lot of times the parents go to sleep with the kids because everyone gets relaxed.
I've definitely been there.
Yes, yes.
And it's interesting that you say that because I had read an article a number of years ago talking about stimulation points inside the hands and the feet to help you be able to fall asleep better at night. And so I started about, I want to say maybe a decade ago, getting into the habit of giving myself, like I'll lay in bed for about 10 minutes and give myself a little hand massage on those points. And then, anywhere, anytime I can get a foot massage, I'll take it, right? But I'm always massaging my son's feet at night right before we go to bed and stretching him out and curling his toes, and winding them back and giving him a little hand massage and just trying to find ways to relax him, to make him drifting off that much, easier. And I think it's interesting that there are so many different unique routines that people can use, and it's very much contingent on your personal behavior and your personal lifestyle, your upbringing, right? Because your upbringing can have so much impact on the habits you form and the routines that you form. So yeah, I know that some of the tips coming out of the NSF are, like as you had mentioned in the past as well, reduction in certain stimulants, upwards of 4 to 6 hours before you go to sleep. So, things like caffeine or nicotine or, maybe processed sugars. Do you have any kind of tips on kind of the timing of routines for anyone who's watching who may be trying to apply this to their existing practice, or if it's a potential patient who's watching as well?
When I speak with people who travel on the road, for example, people who are kids who are playing sports, truck drivers, fire and rescue, one of the go-to snacks, because it's portable, is the bag of nuts with the dried fruit. Well, the dried fruit and the nuts are infused during the processing with caffeine. So when you think you're having nuts and something that is healthy, you're actually getting caffeinated. And that is in the manufacturing process. So you have to be careful, at least be cognizant of foods like that you don't expect to have caffeine in them. And cherry juice was always my go-to, and still is, for relaxing. It supposedly helps with melatonin production, and I believe it works for me. It's part of my pattern. So dark cherry juice.
Okay, nice.
Mhm.
Those are good tips. I appreciate that. Yeah, I had, it's funny. I had read one time, and I think it's an interesting correlation, right? Because you had mentioned, you talk about, sensory sensations, how the sheets feel, what you should be eating. Maybe it's a particular type of clothing that you're wearing that may provide comfort or discomfort, right? Something loose versus something more fitted. And I had read somewhere that they explained the difference between physical therapy and occupational therapy as a physical therapist will, help you, will teach you how to get dressed and how to stand up and how to walk around and how to drive a car, right? Whereas an occupational therapist will teach you that you need, you shouldn't walk out of the house naked or walk into incoming or oncoming traffic, right? That there's the differentiation between the physical gross motor skills and then the kind of sensory processing and cognition and fine motor skills, right? And so, do you have any kind of are there any type of physical therapy, attributes inside, your practice that are applied in relationship to or adjunct to occupational therapy practices?
Yes, we use occupational therapists when a patient is being introduced to CPAP and they have sensory issues. If they are very sensitive to anything going by their face or having any kind of restrictions, we work with the kids, and the occupational therapist will work with the child and the parent, putting the mask on, taking it off, letting them play with it. Maybe they throw it, then they put it back on. Maybe the mom wears it, the occupational therapist wears it. Definitely the sleep technologist will put it on. Everybody puts on the mask and gets used to it. And you get accustomed to that feeling of the mask on your face without air, just the rubber part and the interface. And then maybe you spend 10 or 15 minutes with it on. And then 20 minutes watching TV. Take the hose off, put the hose back on. Still no air, but getting used to it. Week after week, it becomes a habit.
Yeah.
They go to bed and they have the mask on and they get used to it. So there are 4 steps in doing a CPAP mask fitting, and one of them is introduction. The second one is acclimation. They have to practice because then it becomes part of a routine, just like putting your retainer in after you've had braces or putting your glasses on. Get up in the morning, if you need your glasses to see you, put them on.
Yeah.
And I think when the kids realize that it helps, that's when the occupational therapist and the sleep technologist feel so rewarded. Yeah. Because you've taught them a behavior and they know that it works.
Yeah. Awesome. I'm glad to hear that. And I imagine that depending on, the gross motor skills and the ability of the patient, do you ever run into an issue where the patient is not able to put it on themselves and they require the support of a physical therapist in order to be able to kind of put on any type of gear?
That's where the occupational therapist a lot of times will work with the parent and the sleep technologist as well. They show the parent how to take the gear on and off.
Great.
And they teach the children as well. And they let the parents know what to look for in case there are concerns. Like if the mask is leaking air into their eyes, we want to make sure that the air doesn't dry the patient's eyes out. And same with adults. A lot of occupational therapists will work with adults. And that's an interesting case because sometimes you're asking the adult not to smoke, which is something you brought up earlier about not smoking, not eating certain foods. And an occupational therapist will work with them on that. That's a hard habit to break, and it does affect your sleep.
Absolutely. Mm-hmm. Absolutely. So with that said, what are some of the ways to make modifications for that? Or I guess maybe what are some kind of specific markers that you educate on? Like we've said, we educate on changing the bedtime routine and adjusting, sounds and noise and lighting and temperature and bedding, right? And the technology that's used in the bedroom. So what are some kind of typical guidelines that you give for a healthy wind down bedtime routine? right? Like what kind of temperatures are they trying to adjust to? What type of noise are they trying to adjust to? And as we know, we've talked so much about lighting in this workshop, but feel free to comment on that as well. But yeah, are there any kind of specifics that you lend during this education process?
It's interesting because I used to have a set of rules that I went by when I gave presentations. And we talked about the temperature of the room, the quiet environment, the lack of stimulation, whether it be a sibling or a parent or a dog moving around in the bed, keeping you awake. And I was in Australia with a psychologist who was doing a parenting group. In Australia, after you've had a child, free parenting groups are available to the families. And the environments consisted of 4 people. And some of these families where 4 people sleep in one room. Mm-hmm. And so you can't restrict temperature. You can't restrict the noise or the environment. So rule of thumb is you want to have a cooler sleep environment. Okay. You want it to be quiet. If it's not quiet, you want to be able to embrace that noise, whatever that noise is, whether it be the people living upstairs or a sibling playing video games or a TV. So you teach the child, or you teach yourself, how to embrace the noise. So you are going for quiet. Earplugs work great. They work fantastic. Sleep phones work great. The headband where you have the noise in them. Mm-hmm. There are lots of different brands out there. And you want darkness. So if the darkness comes from an eye mask, then you're limiting the exposure of light, which is fantastic. You want it to be dark. That eye mask could also be part of the behavior. And if there is something else that's going on in your environment that you can't control, then you're controlling it with your mind accepting the noise and your light being blocked out with the eye mask. And some people will have a routine of music. So it becomes a pattern. And if listening to nature works, then that's what you would play on your phone or a tablet, but not close to you. We encourage not having phones and technology near the bed, in the bed. Some people have to. Parents need their phone in case a child calls. Some kids are doing homework right before they fall asleep. If they do that, we recommend that they dim the lights. New research is showing that even with the dimmed lights, it's still keeping them awake. It's still a source of alertness.
Yeah. Well, and what we've seen is, as little as 5-foot candles from a vertical plane and as little as 10-foot candles from a horizontal plane, which seems like a very little amount of light, but it's very easy to get when you have, the existing light sources that people traditionally use inside, home environments, especially if you're using a 100-watt bulb versus a 40-watt bulb, right?
And I know we talked about that yesterday with the lighting, and I thought about more and more last night as I walked through my home just for today's talk. And I have light coming from so many different sources, including my bathroom plug.
Yeah.
My plug has a tiny little light. I don't know what it is. You would probably know, but so that you can plug something in the dark.
Yep, that's exactly what it is. And, it's funny you bring that up because we talked about, just before you came on, that headlight, right? That high contrast light versus maybe a larger plane. And how uncomfortable is that small little LED on your bathroom plug when you look at it? For some reason, it's just so visually uncomfortable. And it's because of that concentration of light in one small area in comparison against such a dark, large contrasted area. I cover it. I hate it. I cover it. Anything. And it's interesting because, you're right. You have to use what you have available to you, and you have to get acclimated to what is existing for you. I haven't mentioned it yet. I'll talk a little bit about it tomorrow in my discussion for those of you who are joining today. My son was born premature at 25 weeks. He was in the NICU for 7 months. And when we came home, we had a number of home health equipment interventions that we still needed to help him with, right? So he's on an oxygen concentrator that is so ungodly loud. He is hooked to a pulse oximeter monitor that beeps and sends off alarms anytime his heart rate goes below a certain limit or above a certain limit, or when his oxygen goes above or below a certain limit. And so it's just so much ambient noise, and all of that equipment has lights to be able to see. So there's so much ambient light coming out as well. And I talked to some of my NICU mom friends, and particularly, ones who have been through it for years and are out of the thick of it, but they talk about this PTSD, how they can still hear alarms at night, even though the alarms aren't going off anymore, and how difficult it was to adjust to a lifestyle without the ambient noise and the ambient lights, once their children got better. And, we're doing okay in that adjustment right now, but we still require a decent amount of equipment, at nighttime specifically. And so I'm always walking around, like I said, just like with the light, the light on the plug, I'm going with his little small blankets, and I'm covering up little moments of light on his equipment to try to lower that light level so we don't have a green glow in his room, right? Because it's kind of creepy, and it provides, a little bit too much light. Like, he's just awake, stimulated, looking at everything that's glowing in his room. And it's like, no, nobody, you need to fall asleep. So there's a lot, to be said for getting used to the things that you just can't change, right? And his concentrator puts off a lot of heat. So we have to orient the concentrator in a way where the heat is being dispersed away from the bed, but it doesn't change the fact that heat is being expelled into the room, right? And so, so then we have to put the fan on, and then the fan makes sound, right? So there's so much that's going on from a sensory input standpoint that sometimes you just have to get used to. And I think that's a really important, note to make. So it's definitely been important in my life, and I know in the lives of special needs parents, and of course with parents, and caregivers of individuals who have sleeping disorders, who have to use the CPAP machine, right? So I appreciate that insight and you sharing. And yeah, I think we are coming up on 1 hour, so I am gonna have to, do a final send off. But do you have any final notes before we end? Also, the lawn guy just came, and I don't know if you guys can hear it in the background. I apologize for that. So I'm gonna try to wrap this up before he comes back around again. Any final notes?
Sleep well, be well. That's it.
Sleep well, be well. Yeah, and that's what I always wind up saying. So on that note, everyone, thank you so much for joining us today. Please drop a comment. Let us know how you're feeling, how you're doing with this workshop. If you have any specific questions for Nicole, go ahead, drop them in the comments. We'll make sure that she gets them. She is inside the groups, inside your questions and comments, so that she can get that notification directly. Go ahead and do so. Yeah, from she said it herself, and I will reiterate that message as always: live well, rest well, and live lighthearted. Take care, and I'll see you tomorrow when we talk about light wellness and holistic practitioners. See ya.
Bye. Thanks.